right, good morning, everyone. Thank you all for being here this morning. My name is Melissa Williams, and as Kate mentioned, I'm the Manager of Healthcare Policy and Advocacy with the National Patient Advocate Foundation. And because we're going to be spending a couple hours here together this morning, I just thought I'd share a little bit about myself. I've been working with the National Patient Advocate Foundation for a little over 3 years now. My background is in public health, and I'm incredibly passionate about improving healthcare delivery, and just really excited to talk to you all about understanding health insurance, what that means for you with the coverage you have, what that means for your children and the coverage that they can have, especially in light of some of the proposed policy changes that we've been hearing about in the news. So we'll talk about that today. So about the National Patient Advocate Foundation. So we are a national, nonpartisan, nonprofit organization that's based here in Washington, D.C. We were founded in 1996 along with Patient Advocate Foundation, and we represent the voices of patients and caregivers, any disease all throughout the country. We represent their voices, and we help bring those voices to the forefront of health system delivery reform. And our mission is to promote equitable access to affordable quality care. Now, as Kate mentioned, we are the sister organization or advocacy affiliate of Patient Advocate Foundation. So Patient Advocate Foundation is also a national nonprofit. They're based in Hampton, Virginia. And they provide direct case management services to patients and caregivers all throughout the country. Patients and families who are dealing with chronic, debilitating, serious illnesses. Our case managers are there to address issues that range from transportation issues to get to appointments, debt crises, copay assistance, and dealing with insurance appeals. Our case managers are rock stars dealing with those issues, and they, as it says here on the slide, they really seek to safeguard the patients through effective mediation, assuring access to care, and making sure that they can maintain their employment and preserve their financial stability. Ellie, who will be presenting the second half of this workshop, will speak a little bit more about Patient Advocate Foundation and the wonderful work that she does there. And I think this will be a really great resource to you all, just so you can ask questions once we are done with our presentation about the work that we do. So, as I mentioned, Patient Advocate Foundation, they take questions, anything related to things affecting the quality of life for patients and families dealing with serious illnesses. They assist one patient at a time. We at National Patient Advocate Foundation, we take those individual cases and we look to see if there are any sort of policies that we can either develop or help advance that can either benefit or protect patients and families. So we do that by working in policy. We work both on Capitol Hill and in state houses. We submit comments through the regulatory process. And we also have a network of volunteers that we refer to as our grassroots, and they really help amplify our mission, our voices, and help educate people within their communities about the issues that we care about and what we feel all people should care about. And so before I dive into insurance, I just thought I'd make this little portion a little interactive here. And so I know many of you are parents, caregivers, or have been patients yourselves. And so I wanted to ask you, what is the source of your greatest stressor? This sort of exercise here, this little interactive exercise isn't my idea. I'm borrowing it from my colleague who works over at Patient Advocate Foundation, Shanta Chambers. So we were at Denver earlier this week, and we asked that same question to the group of people that we met with there. And this was a group of caregivers, people who worked in healthcare, and these were their responses. And again, it isn't different from, I think, what you all have contributed here, even though you all come from very, very different backgrounds. This was the first one that was yelled out, making sure that they have affordable housing, access to healthcare, you know, transportation to get to appointments. These were all of the things that they had described. And this list here is why National Patient Advocate Foundation and Patient Advocate Foundation do what we do, because we want to help people address these obstacles to accessing quality, affordable healthcare. So each year, National Patient Advocate Foundation puts together a list of our policy priorities, and it really aligns with the list that you all just helped generate. And this really serves as our framework for how we help advance how we advance our mission for the year. And so you can see that it really just goes back to our mission of promoting equitable access to affordable quality care.